Limited bed capacity and inadequate housing at the Uganda Cancer Institute Mulago are crippling efforts to fight childhood cancer. The rigorous treatment regimen demands frequent hospital visits, yet many children and their caretakers struggle to find accommodation near the facility. In response, Uganda Cancer Institute is organizing the third edition of the Children Cancer Run on May 18, 2025 to raise funds for a dedicated hostel, and the facility aims to provide a safe haven for young cancer patients and their caregivers during treatment.
In the quiet corridors of pediatric wards, where laughter should echo, families are left in despair as children battle life-threatening conditions with little hope of survival. Yet amidst the struggle, their courage shines, a testament to the unbreakable spirit of a child determined to live. Globally, at least 400,000 adolescents are diagnosed with cancer annually, with 80% living in low and middle-income countries. Africa bears 40% of this burden, yet survival rates remain dismal at just 20%.
We chose to do the run because we want to complement on the efforts of the Uganda Cancer Institute. The Uganda Cancer Institute is very focused on very technical things. How can we make sure that the medicine that we are using is able to treat children? Can we have more oncologists? Can we have more nurses? Can we have better buildings?
This is going to be the third run. The first and the second were pretty good, and I've seen improvements every year.
In Uganda, an estimated 3,278 children develop cancer each year, with over 80% seeking treatment at Mulago Cancer Institute. Alarmingly, 2/3 of affected adolescents die without ever reaching medical care. Despite the establishment of a pediatric cancer unit in 2012, inadequate resources continue to hinder effective treatment.
More than 80% of this burden is actually seen here at Uganda Cancer Institute. And so that means that 2/3 of our children and adolescents that develop cancer in Uganda are dying somewhere. We don't really know where they are. And so we also have a job to see that more and more children will come into care and have a chance at cure.
The high indirect costs force many patients to abandon treatment. Blood shortages and severe malnutrition, which force medics to adjust doses, further complicate chemotherapy survival, with over 50% of patients failing to complete their treatment, often leading to fatal outcomes.
Comorbidities. A lot of our children are severely malnourished. And because they are malnourished, they cannot tolerate the high doses that are required for cure. And so many times we end up adjusting downwards the dose that they should be receiving. So if you have malaria and you're supposed to take 3 tablets, but we give you 2, you actually won't get cured. But some of our children, if you gave them the 3, then the medicine will kill them. So sometimes we have to adjust the dose downwards because of comorbidities, and also those affect cure.
Proceeds from this Childhood Cancer Color Run 2025 will go towards building a hostel to ease the burden on affected families, ensuring more children receive the care they desperately need.
So the hostel in this regard is going to help in housing such patients. Remember, this patient has been receiving medicine, for example, from Bara, and medicine which is chemotherapy. And now, if the time or schedule for radiotherapy comes, radiotherapy is only here at the Uganda Cancer Institute, Kampala. So you find that they have no relatives around, and yet we cannot keep them in the ward. The ward also has a capacity of about 45 patients, and so sometimes we are full, and even we go beyond that.
Some of the partners in this Childhood Cancer Color Run 2025 include SMS Construction, Enoch, Crane Cargo, Rock Telecom, among others.
But one of the things that gives us strength and renews our strength is seeing that, one, there are survivors out there. Two, seeing that we are able to make a difference by actually taking an active step towards making sure that some of the children are cared for.
Crispus Arinitwe, UBC News.